Hello everyone, this is Tom Fox and I would like to welcome you to episode 210 of the FCPA Compliance and Ethics Report. The FCPA Compliance and Ethics Report is sponsored by Advanced Compliance Solutions, your one-stop shop for all things FCPA compliance and ethics related. Today I visit with Don Sinko. Don is the Chief Integrity Officer of the Cleveland Clinic, a world-renowned healthcare provider. I caught up with Don at a compliance event in Sao Paulo, Brazil, of all places, where he was a keynote speaker, and he was able to take some time to sit down and visit with me about his observations about compliance in Brazil and some of the unique challenges he faces as the Chief Integrity Officer of a worldwide healthcare provider. The episode comes in at just over 18 minutes. I hope you enjoy it. Thank you very much for listening. Hello again, this is Tom Fox, and now I have with me Don Sinko. Don is the Chief Integrity Officer of the Cleveland Clinics, and he is here in the conference at Sao Paulo, and I asked him if he could take some time to give us his thoughts about the conference, kind of what's on his mind and where he sees things going in the future. So with that, Don, thanks very much for visiting with me.
Great, thank you. Thanks for having me.
What have been some of your impressions from this compliance conference that's been organized in Sao Paulo?
Sure. I had a couple. One, kind of as a step back, this kind of reminds me of the United States maybe 10, 15 years ago when you look at the size of the conference and the people involved. And, we've got about 200 people here. And, in the United States, it started out that way, and then it grew into now in hospital compliance, we get like 2,500 people attend. So I kind of see that as the seeds as to start here in Brazil. And the other thing I've been very impressed with here are the number of executives that are here. The people on the panels and the people in the audience. We have CEOs, we have presidents of the hospitals here, as well as the compliance people. So it's great to see that the compliance efforts that are starting in healthcare compliance here in Brazil have an executive focus, and it's not just sending younger staff and tell them to learn, but the executives are here, and they're heavily involved in wanting to do the right thing. The third thing I thought that was impressive yesterday, at the end of the day, they had executives in healthcare and insurance and from the unions sign a statement, basically a pact that says we support the compliance efforts of Brazil and we want to be the leaders of that effort. And I thought it was pretty impressive. They had them stand up on stage and literally have this document, and each took their turn signing the document, basically pledging support for compliance. So I think that's pretty impressive here for a country that's now focused in that area.
That's certainly interesting. One of the things that has interested me that dovetails into what you said is there are a lot of people asking the questions along the lines of how do we set up compliance programs for distributors? How do we build and bake in a business solution into what we perceive as the legal problem of compliance? And then how do we bring this discussion to the academic arena to train our next generation of business leaders? So I think your comments about the compliance perspective coming online here in Brazil and perhaps a few years behind America is spot on.
Yeah, a great point. And, the other thing is the fact that they have you and I coming down here. I was a little surprised at first that one of the reasons we're here is they really don't have much in the way of compliance programs down here. I mean, they literally are asking us, what do we do? How do we do it? And, today your presentation was terrific on FCPA and what the efforts are in that and why they need to do it. I was presenting the 7 elements of an effective compliance program and basically giving them a roadmap of if you have nothing, this is what you do to start, and if you can do these things, you can develop a world-class compliance program. So I found it interesting to just what you said, that they really don't even have the basis, but they're wanting to learn, and they're bringing in the people who they think can help them do that, and then spreading it not just in hospitals, like you said, but in academics and trying to bring everyone around. It was impressive.
Don, as you know, I practice in the FCPA anti-bribery, anti-corruption space, and your current focus is in healthcare with the Cleveland Clinic. And I think most people understand that the doctors have an ethical obligation to almost from the minute doctors were created coming forward, and you have a lot of other areas of a compliance regime as a healthcare provider. So could you take a few minutes to describe to my audience who may be focused more on FCPA really the incredibly broad nature of your ethical and compliance obligations?
Sure. When you look at healthcare, it is pretty broad. Obviously, in healthcare, when healthcare compliance first started, and it was in the late 1990s, the focus was on billing. As many people know, anyone who's gone to the hospital or has gone to the doctor, healthcare billing is complex. The way the system has been set up, it's very complex, not only to read your bill, but to do the billing process, because depending upon what services you're provided and the level of services, it impacts what the actual charges is. So compliance in healthcare started with billing. It was almost totally focused on making sure we bill insurance correctly, the patient correctly, and the government. But then that really expanded. So then 5-6 years later came HIPAA. We now in compliance in healthcare spend a lot of time on HIPAA compliance and protecting patient data, not only from inappropriate access, which is always an issue, but now with all the cyber issues that we have in the country, where people are going into a lot of industries trying to get people's information to steal identities. In healthcare, the front page of a person's medical record has all the information you need to steal someone's identity. It's got name, address, social security number, date of birth, basically right there on page one. So we spend a lot of time in healthcare on privacy and security, and the government has a lot of regulations in that area. The same thing with from an ethical standpoint. As you know, doctors have significant ethics from the treating the patient. But one of the concerns in healthcare in general right now are unnecessary procedures and performing procedures that may not be necessary by the patient. And that we're talking about that down here in Brazil, that is a big issue here. At Cleveland Clinic, we've kind of addressed that issue right from our start. Cleveland Clinic was founded in 1921, and the Cleveland Clinic is basically a large group medical practice. We're run by doctors, and all of our physicians are salaried employees. So at the Cleveland Clinic, there is no incentive. They have no drive to do procedures that are not necessary, because whether they do 5 surgeries or 3 surgeries, or they request an MRI or whatever, it doesn't impact their salary. So it really helps from the ethical standpoint of when they're salary based, there's no need to perform procedures and do those kinds of things. And that's an issue, as you know, with healthcare reform, that they're focused on. And then we have healthcare reform, and healthcare leaving one of the most difficult for last. So now healthcare reform has come on, and that is very complex. As you know, we had to pass healthcare reform in order to try to understand and read it, and some of the things are just coming out now. And so it's very complex in our corporate compliance world of making sure that hospitals comply with the regulations, and first understanding them. So it's corporate compliance in healthcare is pretty complex. And let me add one other thing. Organizations like Cleveland Clinic are international in nature. We've just recently, in April, opened a new hospital in Abu Dhabi. We just purchased a building in London, England, that we're going to be opening a hospital there. Plus, we have a lot of other affiliations and arrangements around the world, which is why Foreign Corrupt Practices Act is on our agenda. And we do training in that area and making sure that not only the people who travel and deal with foreign officials, but also people in Cleveland who may deal with them either by telephone or electronically, understand what our policies and procedures are and what our exposures can be, and personal exposures. So it's very complex.
One of the things that's intrigued me have been some of your thoughts and ideas around whether or not the compliance function should be a part of the legal function or not. And you, I think, I could say, are very strong views on that, but it's largely based upon your experience. So could you share with us your thoughts along those lines?
Sure. We established the Integrity Office at the Cleveland Clinic about 10 years ago, and it was senior management and the board that wanted to basically separate corporate compliance from the law department. And if you look at kind of our view of responsibilities in healthcare, there's kind of 3 main areas along this line. We have the Ombudsman's Office, and the Ombudsman's Office is often thought of as the patient advocate. Basically, when patients have complaints, the Ombudsman, researches and try to support, what their concerns are. And then you have the Law Department. And really, if you look at what the responsibilities of the law department are, or any law department, it's to protect the entity. It's to do what you can to protect the entity. When you look at corporate compliance, we view the compliance function as kind of being independent of both. It's doing the right thing. What's correct? Is the government right, or the patient correct? Is the organization correct? It's to be an independent, or I probably should say objective, because we are employed by the organization, but to be objective in determining what really happened, do the investigation based on a clean sheet of paper, and then determining what is the right course of action, and making sure that there's sunshine on it, so that it's not trying to keep everything hidden and suppressed because we want to make sure that we're protective. It's no, we want to do the right thing, and I think our work with the government entities, I think the government entities understand that the Cleveland Clinic wants to do the right thing, and I think that's a benefit for us, that they know that we're independent of the law department and the other organizations within the clinic, and they know that we're going to do the right thing as a result. And as an integrity officer, it's kind of on me to make sure we have integrity in what we do and that we do the right thing.
Because healthcare had compliance obligations really before the ramp up of FCPA compliance around 2004 going forward, I think your industry is a bit more mature than many other industries, or at least those that have had to implement anti-bribery, anti-corruption programs. And one of the things that struck me was you've talked about, I believe, the Office of Inspector General and some of their thoughts on where they think this compliance, ethics, and integrity office should lie. Could you give us those?
Sure. Well, the Office of Inspector General, the OIG, in April came out with guidance to boards of directors. Right. And they came out and said, to boards, here are the things that we think you should be doing in order to determine, the setup of your compliance organization. And first of all, we were very pleased at Cleveland Clinic when we got it and we went through it, is that we're compliant with it. We were already doing the things, and I think our integrity office structure kind of fits to what the OIG is looking for. So I think that that's important. But when you look at what they were saying is, one, they want to make sure that boards understand the relationships between the law department, internal audit, corporate compliance, human resources, because they're all involved in basically compliance activities. And does the board understand, how that works? Do you have avenues in place for information to flow, that patients or employees who may have concerns, that they can report those concerns? So basically, do you have hotlines or the like that are independently reviewed and handled and investigated? It's looking for those types of things, and like I said, we were real pleased. First of all, we agree with what they were saying, obviously, and it kind of fits our model, so we were pleased with that. But it's the right thing to do.
You had a really interesting example of the Cleveland Clinic policy of no gifts and gratuities to be paid to clinic employees. And whereas I would have, as a lawyer, have thought of it in terms of bribes in procurement or a gratuity which may lead to a benefit in other areas, you actually talked about it in terms of an employee morale issue, and how if a certain patient gave gratuity to a nurse or other healthcare provider for what you would call expected service, that could lead to really some hard feelings in the nursing corps or in other employees. I thought that was a great perspective, and certainly it spoke to me as the difference in the way perhaps an integrity officer would think about a problem as a lawyer might think about it.
Mm-hmm. Yes, I mean, we're looking at it from the standpoint, and I think what you're referring to is when there are patients from some countries where it's perfectly okay to give large gifts to people who help you or who serve you. And one of the concerns that you have in that situation is you don't want to have it so that particular employees or nurses all want to serve those types of patients because they think they're going to get large gifts, versus if you're serving other patients, you're not. So we have a policy and a rule that that either you can't accept those, or if you accept them, they either go to the benefit of all, or that the stuff is donated. So we had a situation where somebody was given a very expensive gift, and it was felt that that gift had to be accepted because of cultural reasons. But we took that gift and we donated it to United Way to be part of their campaign and part of an auction that they had. So the clinic, while we accepted it, the money actually went to an independent charity.
I'd like to pick up on one of the things you said a little bit earlier in your remarks, and it was around the issue of cybersecurity. That has obviously come to the fore in the last couple of years, and I think many compliance practitioners have struggled with, or chief compliance officers even have struggled with their role around cybersecurity. But you've actually had direct experience with that, where you saw that as a compliance issue and you brought that to the appropriate authority level within your company's attention. Could you describe really why you thought or think it's a compliance issue, and how you were able to help manage that issue at the Cleveland Clinic?
Sure. When you look at cyber issues and trying to get the resources required to combat that risk, solely if you look at it from an IT perspective, IT has a whole lot of different responsibilities and agendas that they have to serve. But when you look at it from a compliance perspective, I viewed cyber risks in the form of privacy and security. So that if you have cyber attacks, and like I mentioned earlier about what's on the front page of a medical record, hospitals now are being targeted by the cyber criminals, because they know if they can go in and get large downloads, steal 1 million patient records, they have everything they need. So from a compliance standpoint and a HIPAA privacy and security, to me, it's one of our top risks. I think I mentioned to you earlier, in healthcare, patient quality and safety is number one. I mean, that is number one by far. But right below it, to me, is the protection of patient data. And not only for our sakes, the patient's sake, but then obviously from an identity theft standpoint. So to me, I went to senior management and the board and told them about this significant risk and why I think we need to be ahead of it. And we did this about 3.5 years ago. So it's not in reaction to what's been happening the last couple of years. We actually had a lot of our not only defensive measures, but proactive measures. We have software where we're proactively looking for issues, not waiting till they come and they get to us. And so while everyone has exposure and you can't be 100% secure, we feel that we're pretty far along the line in that area, especially when it comes to hospitals.
One of the interesting things that you said along those lines was it's not simply a technological solution. It's a personnel or resource solution, and that one of the solutions you brought, tried to bring to bear and were able to convince the board, was you needed to have people in addition to a technological solution. Could you explain how the people part of that works?
Sure. When you look at the technology tells you there's a problem, but it doesn't resolve the problem. So you have to have people involved, so that when technology says that you may have a computer that's been hacked, or that's that data may be getting stolen, it's telling you that that's happening, but it's not taking care of it. You still have to go to that computer, and you still have to get rid of the malware or the virus or whatever's causing the issue. And one of the mistakes that a lot of organizations have made, and we've read about them in the newspaper, is they buy the technology, but they don't pay for the people, the FTEs needed to oversee it and make sure that the problems are properly addressed. And that's the one thing that I was very pleased with our executive management is we were given the FTEs that I felt were necessary to manage the software and make sure that when something happens, because stuff happens, stuff gets through, but do you have the people that when it happens that you can take care of it? And it's been very helpful for us. We've had a number of events that we've been able to stop because we had the FTEs to address it on a timely basis.
Some people may not know what an FTE is. Could you tell us?
I'm sorry, full-time equivalent. So we have people, full-time people that this is their job. Sorry about that.
Well, I'm glad they're at least not reduced to complete acronym. Don, I really appreciate you taking time to visit with me. This has been a fascinating conference, in large part for me because I've had the chance to visit with you, and thank you again.
Well, thank you. I appreciate the opportunity.
Hello, everyone. This is Tom Fox again. I'd like to thank you for listening to this episode of the FCPA Compliance and Ethics Report. I have two calls to action for you. If you could go to iTunes and rate this podcast,